This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning. It's time to get healthy. Welcome to Health Watch. Every Sunday, 8 till 9 here, Talk Radio 1210, WPHT. We're here to help you improve your quality of life. That's our mission statement here on the program. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We're going to talk about the who, what, when, where, why, and how of Innovative Medical Associates, what they do and why they do it, and how it can help you and your family improve your overall quality of life. And if at any time you have a question for Dr. Molly or you want to run by her a particular medical problem that you're having, 855-839-1210 is the number here in the studio, 855-839-1210. That's the number. Call anytime, and Dr. Molly will be happy to help you out with whatever condition you may happen to have. Good morning, Dr. Molly. And
hey,
welcome.
John. How are you today?
Good. And
better, I think. I'm looking at you, man.
I got to tell you, before we start the show, This is why people should come to you, because it's just what you do and how you do it. It's really unbelievable. You said to me, you look a little tired.
Right.
I think I'm going to run some blood work. And I'm thinking, well, that's okay.
Yeah.
You run the blood work and you said, you're a bit anemic.
Right.
And I noticed I've been feeling tired.
Yes.
And I'm going to give you some iron pills. And I'm going to,
in addition to what we're doing in the bag, yeah.
And it's been like maybe 3-4 days, and already I feel better.
Well,
and that just goes to show you why. And a shout out to you, because.
Well, thank you. But John, the real shout out is this: people who follow what my docs and I put together for them, we get to see you a lot. Right? We get to see you a couple times a week, because now not everybody comes in a couple times a week. There's some of them come in once a week, some of them come in twice a month, whatever. But we observe. My nurses observe. I observe. The doc observes. We bring back things. We throw it around. And lo and behold, I said, this is what separates us from a spa. Right there. Right. What happened to you? We know what makes you look the best when you're feeling better. We also know when there's a slight problem. And gosh knows, John, we've had our share of problems together.
That's right.
I've seen you a couple times when we started a show, and I said, no show today. We're going to the hospital.
And we did.
And we did, and thank God we did. And so the bottom line is, our facility is a primary care facility, and it leads right into what we always talk about. Primary care facility, and we can do anything that another primary care doc can do. Our philosophy is what separates us from most primary care facilities. We want to use hydration as a vehicle to help improve people's quality of life, but we do not ignore conventional medicine. So if you need an antibiotic, or you need something for your postnasal drip, or you need something for blood pressure, I have 2 doctors, no waiting. Somebody's going to prescribe something for you, right?
Yes, that's right.
Right. The idea is we use the nutraceuticals to help effectuate the change that we're looking to do, or to help you, and if possible, reduce the side effects of the pharmaceuticals. And that really is what separates us from other people who are doing this halfway.
It's interesting, because you see people, as you said, you see them often, and you see me twice a week.
Yes.
Plus the show. So it's 3 times a week.
Right.
So you get to observe more than, let's say, and I remember when my mother used to go to the doctor.
Oh, yeah.
The doctor would see her for 30 seconds, and that was it.
Right.
And then he would see her another 6 months.
Right.
So it's just, you really take the time and the care.
We try.
really
we try.
improve the quality of life.
That's exactly right. Our mission statement is quality of life. I can't say, listen, I'm only going to deal with your quality of life for the 10 treatments you're doing with me. We can't do that.
No,
that would be totally against the philosophy of this organization. What we do is we're looking at the person. Agreed. We are a functional medicine facility. In other words, we're all about your functionality. So the fact that you were tired was worrisome to me, because tired is a symptom of many things. And with a history like yours, you got to start with some routine things. Now, we also know when to send you to a specialist, and we have several specialists on board for you. You know that?
Yes.
So it isn't like you're in a vacuum. When you come in to see us, we're going to talk to you and say, okay, how can we help this patient improve their quality of life, from the little things to the big things? The biggest issue I have in this particular facility and with our particular patients is that many times people don't get into us early enough for us to really effectuate the change they need in these chronic conditions that are pretty dastardly, like the cancer, like autoimmune, these kinds of things, John.
And if I wasn't coming in on a regular basis, I would have probably just gone on and said, well, I feel tired. It's old age. That's what I thought it was.
Well,
I really did.
You know what? Sometimes many of the physicians out there say, or the physician's assistants or the nurse practitioners say it's old age too. I've had them say it to me. Okay, well, you're feeling like this, Dr. Molly, because of old age. No, I'm not. Okay, there's something going on, and we need to get to it, right?
Yes.
So the good news is we look beyond even what we're treating you for in the moment. We want to see what the tentacles are. Are there other things contributing to your lack of quality of life?
Let's ask you this question. Why do you do what you do? Which is a really
That's
loaded
a loaded question. Okay. Why do I do what we do? First of all, I really believe there was a better medical model out there. And I believe that we put it together. In other words, there's a way by which we can help people using God's ingredients to augment traditional treatments. By that I mean traditional medical treatments that people have to go through, whether it's for the cancer, autoimmune, all kinds of issues, and help the patient reduce their need for pharmaceuticals. And that's really, I got into it for myself. I didn't really like some of the way my physicians wanted to treat me. And by the way, they used to say I was their friend because I worked with them for, 15 years prior to this. I was your pal. I love the commercials now that say, forget about the surgery. He's my pal. Well, guess what? They were my friends too. And they couldn't wait to put me take out that pad and give me whatever quote unquote prescription I needed to effectuate my change. And I just knew that the prescriptions in my case would be worse than the conditions. Now, I will never tell anyone to throw away their prescriptions. I will say, listen, if you have cancer and you can get it out, get it out. If you need the surgery, get it out. If you need to do chemotherapy and you're inclined to do that, let's do it. But our job is to keep you going through that process. If you need immunotherapies, my job is to help get you through those processes and not to really give you anything that would indeed interfere with the conventional practice. That's another reason why we're so good. We have two physicians and two different specialties, really, that they were in. So when we look at a patient, we're looking at them in total. We're thinking, okay, in particular, our cancer patients and our chronically ill patients, what are they on, and how can we improve their quality of life with God's ingredients or the natural products, the vitamins, the minerals, the amino acids? How can we improve their quality of life without hampering their traditional treatment and thereby causing an issue or some kind of antagonistic relationship between the natural and the conventional?
Your cornerstone of your practice is hydration therapy.
Yes.
And why is that?
Because it's the best way to deliver the natural products in a therapeutic level that can effectuate the change with least amount of side effects, but get it to the right, therapeutic dose for your particular case and for the particular patient. And that's really the key to this.
The question that you always get in an initial consultation, Dr. Molly, does this work?
Well, I can say to you, we can show you the quantitative data. We can show you reductions in certain things. We'll talk about a couple cases I had this week of cancer patients. Yes, I would say, yes, it works. But again, you have to be consistent and you really have to listen to some of the things we want you to do. And sometimes that takes a little sacrifice on the part of the patient. You may have to change your diet. I mean, this isn't holy water, John. I say it all the time. But it's not. It's not. You've got to also make some lifestyle changes. Not terrible. They're not, Listen, if you want to go blithely through this world and do what you want to do and load up on sugars, refined sugars and that kind of thing, and maybe even the sweeteners, as one of our wonderful listeners said to me. Bottom line is this. You've got to take responsibility for your health as well as us. But I guarantee you, this is my guarantee, I will give you 180% of my own knowledge in your particular challenge, and I sure will work with my physicians to make sure they stay on board with you.
And I will say you are the best at that, because it's one thing. The hydration is one part.
That's right.
But the other part, to me, the more important part is the way you approach each patient. You come into that clinic, several times a day, and you say, "How are you doing? How are you doing?
Is there any changes?" Yes.
And it's the care that you put into this that really shows, and that's what I think separates you from everybody else.
Well, I think that has been something that I thought was lacking in my own care. We all need a patient advocate, and I would say that in our facility, you're going to get many advocates, not just me. My physicians are advocates. The case of the young man who went back to Indiana, right?
Well, he was in bad
right,
shape.
but my doctor actually got in it. She spoke to the, my docs will speak to the specialist. We got over to a specialist. It was hairy because today you got to go through the switchboard for even your friends.
Yeah, right.
That's why I laugh when they say, "Oh, he's my friend." There are no friends today in the medical facilities. Unfortunately, everything is a business.
We are coming up on our first break of the morning. The show is called Health Watch, and it is here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number, and we always tell you at this time of the program, call now. Don't wait till later, because if you call at 8:55, well, we may not get to you. So call now, 855-839-1210. We are coming back with more of today's Health Watch after these words. We are back here on Health Watch, and as always, when we're on the air, operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. Call and, well, I said when we're on the air, they're there. But when we're off the air, they're there, okay? They don't take off on Sunday. You think we take off with the family or whatever. No, they don't do that. 856-489-0505. And when you call, really the best thing you can do is schedule an initial consultation with Dr. Molly, and that is complimentary. And you'll learn a lot about what Dr. Molly does and how it can help you potentially. So make that call, 856-489-0505, and the website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. The show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. 855-839-1210 is the number here in the studio. If you have a question for Dr. Molly or a medical challenge you want to run by her. And speaking of medical challenges, you normally don't deal with younger people. This young. Right. But this is a particular case where, this is another one of those challenging cases.
Correct.
15-year-old girl?
Right, 15-year-old girl. 100 pounds roughly, maybe 96, 97 pounds.
Wow.
Okay. Lovely, lovely girl. What happened is the people that I treated that went back to Indiana. Well, this particular patient is related to them. And they were calling me from Indiana, and I were giving them whatever I could and putting the doc on the phone. But, really we could see this was a case that we really had to get into. So once my docs decided that it was cool, and I saw some of her analytes and everything, I realized that she's a young girl, she's an adolescent, and we could indeed use some hydration therapy to help her. In fact, I think it's the right thing to do. She's been traditionally diagnosed with ulcerative colitis. So I have been seeing more and more of these IBS, these inflammatory bowel diseases, in older patients or younger. When I say older, I mean people in their 20s. I'm saying older than she. And I'm seeing this in patients that run from late teens all the way up to in their mid 60s, 70s even, John. And I wonder about this, like, why is this happening so much, So I started doing a little research, and of course there are many reasons for this, but it's an autoimmune response to the body from some type of trigger, whether it's stress, environmental, or just the body's immune system having abnormal reactions to normal bacteria in the intestines and that kind of thing. So having looked at this and realizing that she did have the scoping, I got all the medical records. And by the way, I want you to know something. My nurses jumped on this. In the day she came up, I had already had all of, and it was a Bible size, of medical records, so that when we started her, we were able to, divvy up the records and look at particular pieces of the records and then put together a plan for her along with the docs. So in this case, it's been very interesting because, and also for my other Crohn's and ulcerative colitis patients, and I've had plenty. In fact, one of them has called me many times. You've heard him here on the air. One gentleman is a young man in his early 40s. His dad and I went to high school together, and he was my patient, and he brought him in, and he's been with us for several years now. Now, the thing about these kinds of conditions is, first we need to determine the particular section that's working, or giving him problems, small versus large bowels. We need to know about their gut bacteria. We need to know about the markers of inflammation, like the stuff I would do traditionally, like C-reactive protein, SED rates. So all of that is held in the medical records. So we know this kid definitely has ulcerative colitis. Question was, how are we going to treat this? Because the next steps, according to her medical records, she's already been on high doses of steroids. So, that's a problem, too. I mean, high doses of steroids when you're 15, 16 years old. What are you going to do at 26, right?
That's right.
She's been on all kinds of other medication, and now the physicians were saying to them, this is what moved the mom and dad. The last thing that they can try on her is the biologics. And, those biologics are harsh. They're very harsh. They're the kinds of things, we read about Humira, certain other biologics that they use particularly for the Crohn's. This is generally done with a rheumatologist as well as a GI doctor. And again, it's delivered IV. So the parents decided before they would go on this, let's go see our clinic, Innovative Medical, see what the doctors say there, and see if we can help at least control some of the symptomatology to help this kid not have to go on the biologics. So she's been with me since Wednesday. It's not long. Already delivering the nutrition and the micronutrition has already helped her. You can see why, right?
Sure.
She can't eat, right? She can't eat. So, of course, just the IV, nutritional IVs are already helping her. So the question becomes, what else do we need to do? Well, obviously, if this is an inflammatory bowel disease, what do you think I have to do, John?
That's a good question.
Yeah, we would have to use some of God's ingredients that are natural anti-inflammatories. The real question to this is, how much do we use for the underlying inflammation, and not too much to cause digestive issues or whatever? Do you really think she can take these orally? No. But the question becomes about the old story I talk about. What is it? Goldilocks. For example, we know there are over 85 various citations that talk about herbal and plant-based therapy in these types of conditions, the use of. Can you imagine? 85 citations. And that doesn't include the GI group of periodicals that I reviewed, which had several others, many others. So we're looking at many. They know that this works for them. The question is, are we in time? Have we caught this in enough time to really help our patient? So when we're looking at this, we're going to try to look at delivering things like curcumin, and of course putting the patient on challenging diets so that we can reduce the food triggers. And we have to figure about what else can we do and how do we know it's working. Well, we know it's working. Of course, I called the parents over the weekend, and guess where they were? They were in Manhattan looking at the sight seats with the kid.
Okay.
So
obviously she's feeling better.
Exactly. And that's only on really the nutritional portion of this in 3 days. Yeah. So I take a step back and I said, okay, here's what I want to do, guys. I want to look at delivering some of the other anti-inflammatories in our recipe and utilize them a little differently for this type of inflammation as opposed to what we do for, like, say, cancer patients, right? So her new approach is going to be use of curcumin, and I'm probably going to use artisamin, and we're going to use some amino acids. But guess what we have to do? Here's another thing. I look at the literature, my docs and I have a discussion, and we know that L-glutamine is something we can deliver IV, and we're going to. We have to do this very, very carefully. Again, because we know that sometimes amino acids actually can upset your stomach and GI tract. So again, I go to the Goldilocks thing. Why are we different than a spa? I'll tell you why. Because more isn't better. You can't come in and say to me, well, guess what? I want to get the recipe from column B, like you're in the Chinese restaurant, that's going to give you 500 milligrams of glutamine. No, you can't do that. You're going to get a recipe that's appropriate for you. In this case, it may only be 50 milligrams of something. You see what I'm saying?
Yes.
This is a real catch-22, John. You have to utilize these things right. Okay,
we're going to continue with that discussion right after the break. We are at the halfway point of the show. It's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. 855-839-1210 is the number here in the studio. 855-839-1210. If you have a question for Dr. Molly or a medical challenge, feel free to call in right now, and we'll do our best to help you out. 855-839-1210. I'm your host, John DeMasi. We return. Dr. Molly and I come back with more of today's Health Watch after these words. Back here on Health Watch, 856-489-0505. That's the number for Innovative Medical Associates, and operators are standing by right now, and they can take your call if you want to schedule that appointment with Dr. Molly. And that's probably the best thing you can do, because you can really get educated with the initial consultation, and you'll meet some folks in the clinic, and it's just a really good experience for you, and you'll learn a lot. 856-489-0505. And the InnovativeMedicalAssociates.com is the website. InnovativeMedicalAssociates.com is the website. It is Health Watch every Sunday, 8 till 9, here at Talk Radio 1210, WPHT. Let's go to the phones. We're going to talk to John in Bucks County. John, good morning.
Good morning,
Welcome
John.
to Health Watch. You're on with Dr. Molly.
Good morning, sir.
Hi, good morning, Dr. Molly, John. Dr. Molly, this is John, the pharmacist.
Oh, John, how's your little boy doing?
My son's doing fantastic,
Great.
thanks to you. You are. We're on our way to a soccer game right now, and I'm in the car.
Great.
I'm telling my youngest son right now that you're the GOAT, the greatest of all time.
You're too good to me,
I'm telling
John.
my younger son right now.
Hey.
But I was calling you. I'm going to send you an email about my son's update this week.
Good.
But
Thank you.
I was calling about my youngest son's girlfriend, who has Crohn's disease.
Wow.
And was diagnosed with celiac disease.
Oh, yeah. Yeah. Not
and
unusual.
this poor girl can't eat anything, can't drink anything without feeling terrible.
Exactly.
It's horrible.
It's terrible disease. Terrible.
So I'm actually, and I recommend you to working in the pharmacy. I always recommend you. I write your name down, your place's name down. I always say, call this woman, please.
Thank you.
She is fantastic. She will help you. But I was giving the information to her mother, and I want them to reach out to you because I think you can help them. I'm going to try to help them by looking at all their labs and try to evaluate some of these things. But I know you can help her.
Oh, my God, you should. You know, one thing I want to say, John, you know how I feel. I believe what you guys do, the compounding pharmacist, you're not just a pharmacist, but you're a compounding pharmacist. And, you know, I don't know how somebody like myself couldn't do it without you guys, without advice and counsel from you guys. And also, I just feel right now the climate is such, too. They're making it really, really hard for you and hard for me, you know, to get what we need in order to help people in a more holistic manner. And I just think it's a good thing. I feel like we have to be cohesive in what we do. It isn't just physicians like myself, meaning physicians who have clinics like myself, people like myself who understand what's going on, but we have to support you guys in every way we can. And again, I'm going to talk about the Alliance for Natural Health because I'll tell you something, man, it is scary to me how much the FDA, how much the regulatory bodies are going after the compounding pharmacy guys. And you guys are in a very, very precarious positions. And I want you to know that I support all your causes, and I mean this for the global good of people. This is what we need. We need to do more of this and less of the pill pushers. You know what I mean? You can appreciate it, John. You can appreciate what I'm saying, too, in so much as this young girl. Imagine the next step for this kid who's only 15, 16 years old. They want to put her on the biologics, and they haven't tried anything else. It's very nuts.
Crazy.
But you and I both know that's the most expedient thing to do, and certainly is going to turn up enough revenue for the system. So I'm with you, my friend. I will do anything I can. If they need anything, tell them, call me, and I will do whatever we can here and get her back to you. God bless you, my friend. Thank you.
You're the greatest.
Thank you. You're the greatest. God bless.
Thanks a lot, John. Thanks for the call.
John's a great guy.
Yeah, I remember him.
Yes.
Yeah, I remember him now that
he
said
was a
that.
patient as well as a pharmacist, and he's just a nice guy, and if we were able to help, my docs and I were able to help his son.
Let's get back to this 15-year-old girl.
So
now, is this something, in other words, you're going to deal with the challenge now.
Right.
But let's say, down the line, is this something that you don't cure?
No.
But
here's the thing.
Where does this go from here?
Well, here's the thing. What we want to do is reduce the symptomatology that she has, which includes the pain. I mean, it's a very painful condition. And we want to monitor her. I mean, we also use a low dose of a repurposed medication. So, I'm not against the medications. I'm against giving a kid like this the high steroids that she's on and saying you're going to be on those forever, and then we're going to give you the biologics. I mean, that's a really scary thought because at 16, where does she go at 26?
Yeah.
So what we need to do...
There's a lot of side effects,
Oh,
too,
my
with steroids,
gosh.
right?
But here's the thing. What we have to do is we have to make sure that we continue to help her in a way that we minimize or mitigate some of this inflammation, and that she learns to live with this by looking at the diet, by looking at some of the approaches, and learning what the food triggers are. I'm sure that what John is saying, he's looking at some of the labs. One of the things I'm going to talk about is how do we manage our patient? Of course we want you to get the scoping. If you need it, if you need the scoping, you get it. If that's what the doctor needs, and of course he probably does, to make a confirmed diagnosis, that's great. But there are other things we can do in the meantime, like looking at the inflammation markers. So we will follow this young lady with blood and a particular stool test that is called calciprotectin. And this particular test is looking at a protein that is excreted from the white cells that go down into the colon and actually are trying to help put out the fire, as I like to say, right? But the challenge becomes that we can use that as a sort of indirect way to manage how well we're doing. And that's something we will be doing even when she leaves the clinic.
How often do you test? How often do you scope?
Well, right. Well, I can't say the
barometer?
scoping is going to be up to the GI specialist. I mean, he's going to want to scope as much as he wants to. I mean, that's the bottom line. The question is, what can we do to maintain if she starts to feel better and we think the inflammation markers, meaning the blood inflammation markers, are coming down and the calciprotectin is coming down? We could do this once every 3 months and see how she's maintaining. And also we have to look at, has she changed her diet? Are we looking at her taking the probiotics? Are we looking at, which would then repurpose the natural microbiome in her gut? And are we looking at her taking digestive enzymes, which I'm a big believer of, and sometimes they need more and they need good brands. Somebody like John can actually help someone direct them to the really good brands out there. So, I mean, the idea is if we can help mitigate the symptoms and have some kind of markers, then we know, are we improving this patient? Not just hearing the qualitative data that today she's in Manhattan. Do you follow what I'm saying?
Yes.
I need to look at this. I want to look at her vitamin levels, all the micronutrients. In her eye hydration right now, we're looking at A, D, E, folate, beta-carotene, zinc, which is very interesting because those white cells that go down there and excrete this protein, it goes after the zinc in our gut. So we want to replenish that. The selenium, we're going to look at magnesium and iron, something you spoke about this morning. So again, and there are certain forms of iron we might not use for a kid her age. We might use a different form of iron. And in addition, by the way, the iron I put you on is a very new iron that's out, as you can see, and actually it comes from Italy, meaning it was originated, and I have all the data to support using this not to upset your stomach, not to give you the GI.
And it hasn't.
I know it won't. And it's just a wonderful thing. So there are many things I need to do for this patient. And what I'm saying is she's going to be with me a long time, not necessarily through this particular outbreak. But my whole goal is to help her stay with the supplements that she's going to need for the long haul to help reduce the inflammation globally.
And is this something that she's going to be with you pretty much for the rest of her life?
Well, she's going to be with us. She's from out of town. She's going to be certainly with us several times, for several times. In this time, she's going to be with me for several weeks. And then when she goes back home, if we can do what we think we can and eradicate this and really look at the proteins and look at the inflammation markers, and we send her on her way with the orals as well, then I think she'll probably be coming back once every 6 months.
So it's something that's going to be ongoing.
Oh, yeah. She's got to change her. Look, bottom line is, as I said earlier in the show, there's a certain amount of this that has to be done from the patient's perspective. You need to be your own advocate. And I'm also going to encourage her to go back to her GI doctor. I mean, we're all about what? We don't take anything away conventionally. What we do is we bring in some other things.
You enhance
their care. That's exactly right. And generally, we get you to the other side in better shape than you would with just the pharmaceuticals.
And I can attest to that.
Amen.
We are coming up on our final break of the morning, and which means you still have time to call in with a question or a medical challenge for Dr. Molly. 855-839-1210 is the number. That's 855-839-1210. The program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210, WPH.D. I'm your host, John DeMasi, with Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We are coming back with more of today's edition of Health Watch right after these words. We are back here on Health Watch. Operators standing by right now at Innovative Medical Associates. And if you want to call, feel free. 856-489-0505. That's 856-489-0505. When you call, you want to make that appointment for the initial consultation with Dr. Molly. It is complimentary, and you can really learn a lot. call them, and you can call after 9 o'clock. Feel free. They're not going home. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Health Watch is the show, 8 till 9 here Sundays. Talk Radio 1210 WPHT. We're going to the phones. Robert is in Garnet Valley, PA. Robert, good morning. You're on with Dr. Molly.
Good morning, Robert.
Good morning, Dr. Molly. How are you?
I'm great. How you doing, buddy?
I've been better, Doctor. Well, I'm heading into church, so maybe that'll help me.
Oh, God bless you.
Thank you. I'm a 64-year-old male. I've been on pain medication for chronic pains for 23 years now.
God bless you, Robert. God bless you.
Unfortunately, Doctor, back in it was 2003 is when they started to give Oxycontin, and
right.
I was on a tremendous amount of dose of it, and all the doctors. I go to pain management doctor now, and all they're doing is just decreasing my medication,
right,
while my pain is increasing, and they offer no substitute, offer no help at all. So I've been running up through brick walls. Now, I was going to a chiropractor, and she had mentioned ketamine therapy. Do you know anything about that, doctor? And would it be beneficial to...
Wait, what was she mentioning? What was the therapy, my friend?
Ketamine.
Oh, ketamine, yes. Listen, yeah, I absolutely
I never heard
do.
of it before, doctor.
Let me tell you something. Okay, first of all, one of my medical director, Dr. Pat, is an anesthesiologist, and we use ketamine. I don't really talk about it too much, because it's sort of it's talk about a different use for a medication. It's really used in anesthesia, but my doctor is an expert in anesthesia. I mean, she did anesthesia for 30 years. She came to me because she had MS. So yes, ketamine is a wonderful option. You should think about it. But I think there's some other things that might go along with it, and she is correct. You need to do it correctly, though, okay? Ketamine has to be delivered correctly in the right doses, and this I go back to what I talk about all the time, the Goldilocks dose, because you can't, if you use too much, man, you can really do harm, and if you do too little, you don't get it done. So, there's a specific protocol for the ketamine protocols, and where is your pain? Is this global pain, back pain, or
it has been lower back pain majority of the time, going down my legs. It's now I now have 3 herniated discs of my neck here, so I'm starting with neck problems. The situation, I am a funeral director, and all my life I was embalming.
Sure.
So I was bent over for like 10 hours a day in doing this. And we didn't have hydraulic tables that lift up.
Of course.
Of
course. You were doing God's work, man. You're doing God's work.
Doctor, we had to carry these dead bodies up a large flight of steps, usually by myself, to place in a casket. Because the funeral home was old. There was no elevator. There's no lift. So that kind of caused my problem. So I'm reaching out to any kind of hope, like therapy that's out there now that may help me, because this pain medication, I'm so used to it.
You're a young man.
I would assume at this point.
You're a young guy. Listen to me. Read. Do your research on the ketamine. Your chiropractor is a smart lady, and do your research. And if I can help you in any way, feel free to call the office. But please do the research, and it is a good. It's something that's very beneficial, and there are some other things, too, that could go along with that. Okay? May God
Robert.
bless you, Robert. God bless you.
Thank you so much.
You're a good
luck.
man.
Good luck with
Thank
that,
you.
Robert.
Thank
Thanks for
you.
the call.
Nate
is in Philadelphia. Nate,
Hi, Nate.
Good morning. You're on Health Watch with Dr. Molly.
Hi, Nate.
Hey, how you doing?
I'm doing well.
I wanted to know what was the typical price range after you did the diagnostic test and you came up with whatever person needed to help them out.
So you're saying what's the cost of the hydration therapies? That's what you're asking?
Yeah.
Roughly. Well, they can run from $250 to $300 a treatment. Depends on what we're doing for the patient. It depends on the protocol. Again, Nate, it's really specific. I have certain protocols, but we really don't try to beat your brains in. I mean, John, you've been my patient a long time. If you can afford,
years.
Can you afford me? I don't
yeah,
know.
I can afford you.
Maybe I can't afford.
Can't afford not to.
I can't afford. Right. Maybe I don't always can't afford my docs, but I will tell you, we try to be reasonable. If you call the office and you get one of my administrative assistants, they'll explain the program. That's a great question, Nate. It's not out of the reach of the ordinary man. Thank you.
Oh,
Thank you for the question.
I'm really an ordinary man.
Come on. You want to know what I believe in our clinic? Nobody's ordinary. Nobody's ordinary. Everybody's important.
Yeah.
Okay?
Well, not that. My pockets are really ordinary.
That's right. We understand. We understand. God bless you, Nate. Take care.
Nate, thanks for the call.
Nice
Appreciate
call.
it.
Nice call.
855-839-1210. That's the number here in the studio. We want to talk in the few minutes that we have left.
Sure.
You always give us an update on some patients.
Yeah.
And,
I want to talk about one of my patients was referred to me from my consulting oncologist for us to do the integrative piece and the nutritional piece while she was going through the chemotherapy, which is unique in his office. She is doing so well. He texted me over the weekend and he said, "Hey, Doc, want to let you know scans were greatly improved. Thank you for your work." I texted him back and said, no, I have to thank you for your work, because together that's what's helping the patient. Doing a form of the conventional chemotherapy for her. And by the way, it was a pretty bad situation. She was stage 4 of a woman's cancer, very, very aggressive. And it's the combination therapies that are working. And that's why I say many times we do not take anything away from your conventional treatment. What we want to do is enhance it and make you get through it, okay, so that at least you have a quality of life while going through it.
What did you do? Now, we can't say what he does. What do you do?
Well, he did a chemotherapy, absolutely. Yes. He was using the platinums, I believe. What did we do? Well, we kept her liver going. Right? These drugs are tough on the liver. We supported her liver without damaging the results of the chemotherapeutic, which we have to watch. We have to watch what we put in that in those particular IVs. We used a specific form of vitamin C that we don't necessarily talk about all the time. We used folate acid. We couldn't use too much Bs because we didn't want to promote growth. We used a certain amount of the trace minerals and some other things that were proprietary in nature, including things like the frankincense, etc. So there are many things that were used in her IV to enhance the chemotherapeutics and actually got her to the other side.
And whatever you did, obviously it worked.
Oh, it's working, and I'm thrilled to death he's cutting down on the chemo. She has to only go back twice this month. This is a wonderful way we do things. My patient from up north who went and had the radiation, I saw her this week. She said her energy is coming back. She's feeling better. I left her. We again looked at her platelets. We're looking at things that were actually affected, but overall she's doing well. I actually encouraged her to take a particular oral medication that he put her on. I explained why, which his nurse didn't have time to do up at a big institution. And she goes, "Oh, Molly, you knew it." I said, "Absolutely, I would take it as well." It was for a memory enhancement for her. So it's a drug I'm familiar with. Anyway, this is what's going on in our clinic. Also, another patient of ours, Melanie, who started with me, her fiance was the EMT, brought her in, sent her up to my consulting oncologist. She's doing excellent. She was so good. She was coming in every day to me, once a week up to him. Now I've managed to be able to move her down to twice a week with me, and he's probably going to move her to every other week.
All good stories. And with that, we are going to put the wraps on another edition of Health Watch. Don't forget, if you missed any of today's show, we're on again at 4 this afternoon with the Health Watch replay, so you want to catch that there. But for Dr. Molly Fantasia and everyone at Innovative Medical Associates, we'll give out the number, 856-489-0505. If you want to call the office, make an appointment, 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. For Dr. Molly, Fantasia, and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Barbara, Lana, Donna, Jess, Vicky, and Daniel. Then, of course, there's Joanne, Delightful D, Fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thanks for listening. We'll talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.